Hello, everybody. This is Gary. Today is Thursday, August 18th, 2022. It is 3:20 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my coping with schizophrenia blog entry for today. Today, I'm feeling a little weird. I had to go to the emergency room yesterday because I was unable to urinate. And so now I have a urinary catheter like I did last year and needed surgery to correct my bladder problem. Well, apparently I couldn't urinate yesterday, and it went on for about 8 or 9 hours, and it became extremely painful. So I had to go to the emergency room at Strong Memorial Hospital. They put in another catheter. Um, I have an appointment with my urologist next week, which means I have to wear this catheter until then, because if I can't take it out myself, because the catheter has like a small balloon at the end of it inside my bladder, and that balloon is there to prevent it from slipping out accidentally or being pulled out on purpose. And if you do pull it out, it could cause damage. So the balloon is there to allow the urine to flow from the bladder to the urinary bag that I have to carry around with me. Um, I'm not sure what happened or why this happened now. I don't know if it's a reoccurrence of the bladder problem I had last year and needed surgery for. I went through prostate surgery and I went through urinary bladder surgery so I could start urinating again. So I don't know what's going on. It's possible that it's related to my psychiatric drugs because they just increased my Zyprexa, but I don't know that for sure. And I haven't talked to my psychiatrist about that possibility yet. I think what's going to happen is I'm going to see the urologist next week, and we're going to try taking the catheter out at his outpatient office and see if I can void or urinate after the catheter is removed. And if I can, then no big deal. I don't need the catheter. If for some reason I can't urinate, then we're going to have to look at reasons why I can't urinate. Is it because of the same bladder issues I had before? Is it my medications? Is it something else? Um, you really don't know. The tests they ran at the hospital showed I don't have any urinary tract infections. I don't have any infections in my kidneys. My kidneys are functioning normally. Um, Maybe the bladder wall muscles are weak. Um, Maybe my medications, specifically the increase in the Zyprexa, caused my bladder not to be able to void. There's a lot of possibilities, and so now I have the inconvenience of having to carry around this what's essentially a plastic bladder on the outside of me connected to a tube, um, because I'm not sure that I would be able to urinate without it. Um, and so I have to carry this bag with me wherever I go. Um, and so they gave me some Klonopin to calm me down last night at the hospital, and I picked up my Klonopin prescription today at the pharmacy. Um, but that's just an update on my physical issues. Other than that, I have no other physical issues. Like I said, they tested my kidneys. My kidneys are normal. My blood sugar is normal. My blood pressure was kind of high when the ambulance measured it, but that's possibly because I was under stress and I had to go to the hospital in an ambulance. That's enough to raise anybody's blood pressure. But I do have high blood pressure. I take two different medications for high blood pressure. I bought my own blood pressure cuff, which I haven't used yet. My cardiologist wants me to monitor my own blood pressure and see if it's consistently higher than normal, and do I need to increase my blood pressure medication. As far as my psychiatric symptoms are concerned, my paranoia is not that bad. I went out today, didn't feel particularly paranoid or delusional. Um, my auditory hallucinations are at a bare minimum. Uh, my anxiety levels are kind of high, not that intense. I'm not real fond of wearing a urinary catheter. There's some anxiety over that. my depression a little bit. Again, over what happened. I spent like, I don't know, 7, 8 hours sitting in the emergency room waiting to be seen by a doctor. During the entire time, I didn't have a catheter, and I couldn't go to the bathroom. At least not very much, not anywhere near enough. Um, I was passing a little bit of urine, but I still needed the catheter to get all the urine out of my body. So, uh, you know, I came home late. I was tired. I slept most of the morning away today because I was throwing off my schedule. Um, but I spent 8 or 9 hours sitting in the hospital, unable to urinate, and so aside from that, causing some anxiety and some depression, my psychiatric symptoms really aren't that bad today. I'm just taking one moment at a time, one step at a time. Um, I'm hoping that I won't need surgery again. I just got through 3 different surgeries in the past year and a half, and I don't want to have to go through another surgery, but I also don't want to have to stick a catheter in myself with disposable catheters every day for the rest of my life either. Um, so I'm not sure what's going to happen, and my psychiatric symptoms aren't that bad today. Um, just trying to stick to my daily schedule. Gonna go for a walk, use my physical therapy exercises. Although it's more cumbersome to do that carrying a urinary bag with me, I put it inside a shopping bag to hide what it is. But you can't miss the tube running from the bag to my under my pants. I have to obviously the tube is there. People sometimes notice that they don't usually say anything, but they notice it. But just trying to stick to my daily schedule. I missed my therapy appointment yesterday. I had called my therapist and told her about the problems I was having. I may have to go to the emergency room. I ultimately went to the emergency room. I rescheduled my therapy appointment, I believe, for next Friday. Next Wednesday, I'm seeing the urologist. Other than that, there's not much else to report. Tomorrow, I'm seeing my peer support specialist. I'm seeing the psychiatrist in September. And I think I have 1 or 2 other medical appointments. I'm not sure what they're for. I would have to look them up. I generally don't like missing my appointments, but yesterday was really painful and I couldn't go in to see my psychotherapist and take care of the urinary issue at the same time, so I didn't go to see my psychotherapist, but I did call her to let her know that I wasn't coming in. It's the first appointment I've ever missed with her. I think maybe the second time, but not. I don't usually miss my appointments with her, and I will try to keep that appointment next week. I like talking to her. She's a big help. I like talking to my peer support specialist. She's a big help. But other than that, there's not much else to report. Comment, like, share, subscribe.